Okay, guys, welcome to Speaking Editors. Today we're going to discuss in detail regarding all four modules: listening, reading, writing, and speaking. It's not going to be in really depth class, but just like 15 minutes each. We will discuss for 10 to 15 minutes for listening, 10 to 15 for reading, like all the modules 15 maximum 15 minutes, and in total 1 hour. I would like to close the section, and we will have a Q&A section. So if you have any doubts, preference given to the exam batch, they already know, but still others are also welcome. Okay, we only have a non-Mallu here, if I'm right. So non-Mallu understands little bit actually, so that's still fine, but I'll be trying to speak in between in Malayalam also. അതായത് നമ്മൾ സ്പീക്കിംഗ് ക്ലാസ് നമ്മളൊരു 1 മണിക്കൂറത്തെ സെക്ഷനാണ് നമ്മൾ പ്ലാൻ ചെയ്യുന്നത്. ആ 1 മണിക്കൂറിൽ നമ്മൾ 4 മൊഡ്യൂൾസും കവർ ചെയ്യും കേട്ടോ. 4 മൊഡ്യൂൾസ് കവർ ചെയ്ത് 10 മിനിറ്റ് 15 മിനിറ്റ് ജസ്റ്റ് കുറച്ച് ടിപ്സും കാര്യങ്ങളൊക്കെ. അറ്റ് ദ എൻഡ് എക്സാം ബാച്ചിന് പ്രിഫറൻസ് കൊടുത്ത് കുറച്ച് ഡൗട്ട്സുകൾ ചോദിക്കാം. ആൻഡ് ലാസ്റ്റ്ലി അതേഴ്സിനും കുറച്ച് മറ്റുള്ളവർക്കും ചോദിക്കാം. സോ ഐ ഹോപ്പ് ദാറ്റ്സ് ക്ലിയർ ഫോർ എവറി വൺ. And let's begin. Okay, so first and foremost, when you go for your exam, please relax yourself. I know everyone is so stressed, so there is no need to stress. Think that, like I always say, wherever we are or whatever we are doing, we're not happy with what we are doing at this stage. That's the reason we are writing the exam. So if you stress too much, it can reflect in your scores. So just relax your mindset. Pray. That's the biggest weapon. Please pray to your own Lord and be ready. Okay, and I wish everyone the very best in your exams, and we hope that you all will do your best. And I think we practiced well enough, good enough, everyone, the way you guys have started with me and when you joined, and today we are like warriors, right? Everyone is well prepared to write your exams. Even if you have small doubts, we will clarify it today, and tomorrow is our day. Let's say that tomorrow is our day and we're going to do our best. That's the promise, right? Anyways, so let's start with the listening. So when it comes to listening, let's look at a sample. Okay, I hope everyone can see this one. And ലിസ്ണിംഗിലോട്ട് വരുമ്പോൾ മിക്കവർക്കും ഒരു പ്രശ്നമാണ് കൃത്യമായിട്ട് മനസ്സിലാവുന്നില്ല അല്ലെങ്കിൽ ക്യാച്ച് ചെയ്യാൻ പറ്റുന്നില്ല എന്ന്. ദ മെയിൻ പ്രോബ്ലം എവരിവൺ സേസ് ഈസ് ദാറ്റ് ഇറ്റ്സ് ഡിഫിക്കൽട്ട് സംടൈംസ് ടു ക്യാച്ച്. സോ ഫസ്റ്റ് ആൻഡ് ഫോർമോസ്റ്റ്, the modules we are practicing, mostly they are unofficial materials. So that's the reason sometimes you see that we will have long answers, like what do you say, there was a recent topic I saw, in the answer was like pituitary gland or in the some surface, that was like 5-word sentence answer. But in real exam scenarios, you cannot expect something like that. It will be either 1 word or 2 word. It says here on the top, a word or short phrase. It's not going to be a long sentence. So do not get worried, do not get stressed, you can easily write. And when it comes to part A, you need to concentrate yourself. Really, you need to concentrate. And remember, again, this is your first test on the day. You start with the listening. And some of the centers, I think in India, you'll be getting a headset, but abroad, you don't get a headset. You have to listen to the speaker. It's depending upon your luck. And when you practice, you need to make sure that when your exam center is providing a headset or a speaker, like that wise you need to practice, അതായത് നമ്മൾ പ്രാക്ടീസ് ചെയ്യുമ്പോൾ നമ്മൾ അറിഞ്ഞിരിക്കണം മുന്നേ മുതൽ. സ്പീക്കർ ആണെങ്കിൽ സ്പീക്കർ വെച്ച് തന്നെ പ്രാക്ടീസ് ചെയ്ത് പഠിക്കുക, ഹെഡ്സെറ്റ് ആണെങ്കിൽ ഹെഡ്സെറ്റ് വെച്ച് പ്രാക്ടീസ് ചെയ്ത് പഠിക്കുക. ഓൾറൈറ്റ്, ആൻഡ് യു നീഡ് ടു കൺഫേം ഇറ്റ്, does your center has a speaker or a headset. And I believe in India all the centers have headset. So let's look at an example here now. This is a topic for Melissa Garden, right? And here we can assume. That's the only thing we can do here. Assume. How do we assume? So when they say Melissa Garden works as a, that means they're going to mention her profession, right? So it's very simple. While you're reading, you can think and underline the keyword work. That's the keyword you need to mark. Now going to second question, there is medical history. When it comes to medical history, now you know that she's not going to explain her present problems now. She's going to some other things, the previous things, or regarding all the things what happened before. So she says up until now. So has occasional. So you need to underline this occasional, and maybe you can hear some other synonyms there. Is allergic to. When you hear allergic, make sure that you're ready to write penicillin, because 99.9% it will be penicillin mostly. Or if it is mentioned in the for diet, then you can expect something like nuts or any peanuts or something like that. Has a dash diet. You genuinely know now that they are going to mention that she is following a particular diet, maybe vegan or non-vegetarian diet, something like that. Then the next thing you can see, there is a needed. That means she needs something. She needed something before the first pregnancy. So you need to mark needed and treatment, or underline the keyword first pregnancy, because when you listen to that word, particular word first pregnancy, you can easily catch, because it won't go some, most of the times it won't go needed dash needed injections or needed some conservative treatment before first pregnancy. It won't be like that. It will be saying like during her first pregnancy she required a conservative treatment, something like, I mean, I'm just saying a particular word, that's it. So it can come in both ways. Okay, and I hope that's clear for everyone. So this is the way you can expect, you can assume this is going to come. And when it comes to the family history, again family history of, so you underline the keyword history of. You will have 2 minutes, sorry, when you start you will have 30 seconds to have a look at for the first 12 questions. So look at there and underline the keyword. No one cannot teach you what is the exact keyword, but what you feel at that moment, ആ സമയത്ത് നിങ്ങൾക്ക് എന്താണ് കീവേഡ് എന്ന് തോന്നുന്നത് അത് അവിടെ അണ്ടർലൈൻ ചെയ്ത് വെക്കുക. പിന്നെ സെന്റൻസുമായിട്ട് കണക്ട് ചെയ്ത് കിട്ടാവുന്ന എന്തെങ്കിലും ഉണ്ടെങ്കിൽ അത് വേണം കീവേഡ് ആയിട്ട് മാർക്ക് ചെയ്യാനായിട്ട്. അല്ലെങ്കിൽ look at here now, provided her with a leaflet on preparing dash. Maybe you can see here 2 dash, so that means there are 2 things to write. See, there was 1 dash, there is a stop, and there's a dash for new baby. So let's assume maybe some dress and toys, something like that. So you can assume, you need to assume like this. That's the only thing you can do. And remember again, if I share my own experience, when I attended my exam, it was in a speaker. We done through speaker, and the first 2 or 3, in fact, I missed because I couldn't hear it properly. But the reason I'm sharing is that do not get panic. Continue to listen and think that you can easily score. That's the only thing we can do. Again, even when I missed like 1, 2, 3 questions in the first, still I was managed to score like I was managed like 34 to 35 correct answers out of 42. That was my score in listening. So again, think in a way that even if you lose 1 or 2 or 3, remember you still got 39 questions or 38 questions to still catch up. So that's part A. Again, like we say again here, if you look at here, you can again assume if it is like initial treatment, exercise program including stretching exercise, rest, it can be dashed for pain. That means it is a medication, right? Or it may be some ice application or something like that. So it's already saying some stretching exercises, then rest, mostly it will be a medication here. Now it says developments in condition, GP suspected. Definitely this is going to be a disease condition. We can assume here she is going to say that say about a disease condition. അതായത് നമുക്ക് അപ്പോൾ ഇവിടെ ക്ലൂ കിട്ടും. നമുക്ക് GP suspected എന്ന് പറയുമ്പോൾ GP സംശയിച്ചു എന്തെങ്കിലും ഒരു കാര്യത്തെക്കുറിച്ച്. അപ്പൊ അതങ്ങ് ഓർത്ത് വെച്ചിരിക്കുക കേട്ടോ. That is part A for you. So it's if we look there is penicillin again, like we discussed earlier. Then look the diet. I'm also looking first time with you guys. I didn't have a look there. Then what was the question we looked at again regarding the diet? No. 16 dash for pain. Ice packs. There you go. Because that was related to exercise. I'm also looking with you guys. That's the look, because it says initial treatment exercise program including uh, the the reason I'm saying, because this says something related to exercise program, so you can say stretching exercise, rest, and ice packs. Did we had a look at anything else? No. So GP suspected. What is number 17? Tendonitis. Look, that's also a condition, disease condition. So we need to assume and be ready to write something. Again, after completion of 24 questions, you will get few seconds to look at these questions actually. In the what I will say, while they're speaking about this type of things, like in this part of the test, you will have you will hear 6 different extracts. Meanwhile, you can go back and complete your answers. I was also doing a habit, like, if they say something like if the answers are coming continuously, I was leaving some space like this. For example, I was writing like here ice and P for packs, so that when I come back I can remember this was about ice packs. Okay, so that's what I was practicing always. Even when I was practicing, if in case I miss something, so that I can come back. Now let's look at part B. For example, let's look at a question. You hear members of a hospital committee discussing problems in the X-ray department. What is it says? So each question you will get 30 seconds if I'm right. You hear members of a hospital, that means there is a meeting going on and the hospital committee members are discussing with the problems in the X-ray department. That's the issue. The problems are due to a delay. It means the problems. What are the problems? And due to a delay. So here the keyword is delay. Delay in buying a replacement machine. So do not underline the keyword replacement machine. If I am writing the exam, I will mark here buying. Buying is my keyword. Getting approval for a repair to a machine. I will underline here approval. Getting approval, that's my keyword, getting approval. And the last one, identifying a problem with a particular machine. Identify. See, most of them, most will do like replacement machine or repair to the machine, or they will mark particular machine. So when you listened, and you will listen to that particular replacement machine, and you will miss with this repair. So when you hear repair, you mark this, but meanwhile they were trying to buy a, they were trying to they will use some other synonyms there. So we need to be really careful what they say. And another thing, in the exams you need to black this area, particular area totally. You need, with your pencil, you need to black this entire circle when it comes to part B and C. So what I was doing meanwhile, what I feel is like I tick here. If I feel that this is over, then I put a cross here. You put a cross here and you listen to the next 2 questions. For example, if I say there is a question, let's say like Mr. John was waiting in the emergency department. What he was doing while he, and the second says what he was doing. So it says he was listening to music, he was reading a novel, or he was playing games. Now the first says he was listening to music. So for me, listening is the keyword. Second one, reading, and the third keyword is he was playing. So maybe the answer will say John was initially playing games, but he got bored and he changed and he started to read a novel. So this is the way they're going to say. John was initially playing, but most of us do not hear to that initially. And the question says currently what is he doing? So it means 99% will tick for initially. They will not listen that keyword initially. See, they will somehow try to deviate your attention. So they will come with the John was initially playing games. So while we hear to playing games, that is our keyword. You some marked. You tick the answer. But in a meanwhile, they're saying he was initially playing games, but he got bored and he started to read a novel. So the answer will be he was reading a novel. Meanwhile, while we heard about the games, initially you tick and go. So this is the problem. So we need to be very careful about when we listen to the each thing, each keyword. If you look at here again, you hear a vet talking about her involvement in the management of the practice where she works. How does she feel about her role? She accepts that it became, she wishes, she values. For me, these three will be the keywords. So maybe they will say she agree. Instead of accept, they will say she agreed. So they will use different keywords. Okay. Coming to part C. Here again we need to really concentrate. What I was doing initially when I was practicing, rather than concentrating on ABC, I was marking these keywords. You know, when Chris first met the patient, he found that when Chris found. So I will always underline when. That's my keyword for me actually, because I will look when means what is that? When I mean എപ്പോഴാണ് അയാൾ അത് ചെയ്തത്? When Chris first met the patient, ആദ്യമായിട്ട് കണ്ടപ്പോൾ എപ്പോൾ, when he found that she was considering retirement from her sport. Her state of mind has aggravated the pain in her knee. She had ignored professional advice previously offered to her. So you can put the keywords like considering retirement. Her mind of state was aggravated with pain, aggravated, and the last one she had ignored. So these are the keywords. And again in the first stage of this treatment, you mark first stage. Was careful, discovered, and evidence. These will be the keywords, and we need to be really careful what we are listening to actually. Again, here also you will get enough time to listen and mark your answers. And do not get worried, they will not be providing too long words. It will be simply like this. Practice with more with the OET official materials. If you can go to the site, official site, you can easily get the answers. Okay, sorry, the good task you have. So that's it for you for your listening. So some of the keywords you need to carefully listen about. First thing, you need to assume. Second, from part B and C, try to mark on the ends, and once you finish with that particular task, blank the correct answer what you feel at that stage. Once you finish, do not go back and come back and think again. Do not start changing again. Okay, and always make sure, look at the numbers. You're going to write on the same paper. They're not going to provide you extra paper for answers like in IELTS. You're going to write in the same booklet. So that's the main thing. Very careful. അതായത് സെയിം ബുക്ക്ലെറ്റ് തന്നെയായിരിക്കും തരുന്നത് കേട്ടോ. അതായത് ഈ ക്വസ്റ്റിനുള്ള ഈ ബുക്ക്ലെറ്റിൽ തന്നെയാണ് നിങ്ങളുടെ ആൻസേഴ്സും എഴുതേണ്ടത്. ആ ഒരു ആൻസർ നിങ്ങൾക്ക് തോന്നിക്കഴിഞ്ഞാൽ പിന്നെ അത് ഏതൊരു വെട്ടിക്കുത്തി മാറ്റാൻ നിൽക്കണ്ട. വാട്ട് യു ഫീൽ ഈസ് ദ റൈറ്റ്, ഗോ ഫോർ ഇറ്റ്. ഓക്കെ, that's listening for you, and all the best to everyone. Even if you lose somewhere in between, do not get panic. Listen to the next one and write your answers. Okay, we do have a like we say, I always say to everyone, if you miss something here, catch up on the next thing. ഇവിടെ പോയാൽ അടുത്ത 3 മൊഡ്യൂൾസ് പിടിക്കുക കേട്ടോ. That's for you the Let's go to writing. Sorry. Let's go to reading. And here I have a short text here for part A. Reading is very important because we only have 15 minutes and you have 20 questions. Like I always say, we all have different set of plans how to tackle part A. So one of the technique I was planning was like I always read for 3 minutes and then I will start to find answers from question number 8 to 20 followed by the last minute for 1 to 7. But always make sure what if you have a particular plan, stick to that plan on your until you for the exam day also. Do not change on the last minute. Do not think that it will work for you if you if you listen to a new plan. No, stick to what plan you were used to plan you were, when you were practicing and continue with that. So let's look at now the reading. For example, so we have a short note here. So I don't have text A and B here. Let's look at text C here for part A. So it says about some medication options, right? So it says some SSRIs helps increase level of natural good mood. Chemical reaction is in the brain called serotonin. Then we have TCS working raising levels. We have again SN serotonin non-adrenaline reuptake inhibitors. We have lithium carbide. So these are the notes. Medication withdrawal symptoms. Medication should be stopped suddenly unless there are bad side effects. Medication should be gradually reduced gradually. This is to prevent withdrawals, and that include these are some of the withdrawal symptoms here. I'm just reading the notes, then we will have a look at some questions. Now task text D says non-medication options. So it says some cognitive behavioral therapy. So if I'm doing reading, I will only underline this cognitive behavioral therapy. I won't even I'll just have a quick read at this. Then we have interpersonal therapy, underline that one and read it. Psychodynamic and psychoanalytic psychotherapy, underline that keyword. Then we have counseling is a form of therapy that things underline counseling, and we have mindfulness involving paying attention close to the present moment. These things. Then we have ECT is a very controversial and trade. So if we are, and let's go back and let's say that in the for the first 7 questions we need to find out which paragraph is it from. So let's say like they will be asking they will be saying a small word like paying closer attention to present moments, um, like mindfulness. So they won't be giving in a direct way, they will be giving the indirect way. So if you underline these keywords and you write on this side called non-medication options, that was I was practicing always. So try to write something like that here. അതായത് നമ്മൾ പ്രാക്ടീസ് ചെയ്യുമ്പോൾ the way I was practicing, ഞാൻ ഇങ്ങനെ എഴുതി കഴിഞ്ഞാൽ ഞാൻ ഇതിന്റെ സൈഡിൽ എഴുതി വെക്കും നോൺ മെഡിക്കേഷൻ ഓപ്ഷൻസ് എന്നുള്ള എഴുതി വെക്കും. മേളിലാണെങ്കിൽ മെഡിക്കേഷൻ ഓപ്ഷൻസ് എഴുതി വെക്കും. ഇവിടെ എഴുതുമ്പോൾ അതിന്റെ മേളിലെ സംഭവം എഴുതുമ്പോൾ if I'm reading this, I'll write here withdrawal symptoms for me, or I'll put a arrow here, underline here, and I'll put an arrow here like this, an arrow, so that when I look, when I go back, it is easy for me to find out what are the withdrawal symptoms. So maybe one question it says, or let's say like they will be saying in the first 1 to 7 they are asking about some they will be mentioning like general weakness and anxiety, which paragraph. So they will be giving, instead of dizziness they will be giving general weakness or tiredness or something like that. So we need to know the synonym. Or they will be providing vivid, instead of vivid they will be providing some other words, dreams at night, dreams, or something like that. Or they will be saying lithium citrate, or they will be saying paragraph which shows about withdrawal symptoms. They will only providing withdrawal symptoms. So if you mark this withdrawal and arrow this thing, then you know when you come back you can know this will be there. Or if they say like controversial therapy, so now you know when you mark ECT, you know when you look at 1 to 7, you know this will be controversial, so you can easily write that is text D. The remaining 8 to 20, they will be saying like dash is a form of therapy that helps a person to think about their problems. So if you underline this and you mark it as non-medication options, then you will automatically remember that this can be counseling. Or if you go back, which helps to increase the level of natural good mood in the chemical brain. So most of them will be writing serotonin. Meanwhile, the answer will be selective serotonin reuptake inhibitors. What helps? അല്ലെങ്കിൽ what helps to increase? It will be saying what helps to increase the level of natural good mood chemical in the brain. This is what is called, but it says what helps means selective serotonin. So we need to be very careful when you answer. Or if you look at the another example, they will be asking dash and dash are the withdrawal symptoms uh, due to withdrawal symptoms and the continuation, something like that. So you can sometimes they will be saying about some particular thing. So here you have this many options, so you can write any two. It's not often, I'm just saying some of the examples. It won't be like this, but there you can expect like that. Now when it comes to part B, remember again in reading part A, after your part A 15 minutes, they will be taking away that booklet, and after that they will be providing a new booklet to write to do. So that will be part B and C, and there you have 45 minutes remaining. What I was practicing or what I did in my exam was exactly when I got part B and C, because when I finished with my part A, it was about anaphylactic shock, and I was completely sure that um, you know I was 100% sure that I will score 20 out of 20 because it was easy. And if I remember correctly, I finished almost 3 minutes before also. It was actually, it's not that easy, but we should do some regular practice, especially last 20 days I was practicing like every day after my duty, and after the supper, like the time we take to play or watch something in the YouTube, from that take 15 minutes to practice part A. Mostly I was practicing part A in listening and part A in reading every day, and once in a week or twice in a week I was practicing the entire listening and reading. Otherwise most of the days I was practicing only part A. And especially during the week of exam I was mostly practicing only practicing part A, because if you can score in listening and reading from listening 24 out of 20, and if you can score something 18, you can easily score that 18 out of 20 or 20 out of 20. Then remember you still got 18 questions in listening, and you only have to score that out of 10. Again this side also, if you can, then the remaining, when it comes to reading, you remaining have 22 questions, and if you can score at least 14 or 15 out of 22, or at least another 10, if you get 20, you are survived. So we can easily, you know we can easily score actually if you practice properly. Do not get stressed. If you start to get stressed, it can automatically affect your all modules. So please relax yourself, pray to the Lord, pray to our Lord, and be strong. Now let's look at part B. So what I was doing in the exam, I did a different approach, because when I look at part B, I looked at 6 questions, and it was really tough for me. It was really tough for me, and I was unable to read. When I looked, it was about all about some data and everything. So I went back to part C. Then I saw one was about some concussion and the other was about some old age people who are dying in old age home. And when I read the first part, I found it that this is very easy. So I did that part C, question number 16 to 22. That's 7 questions. I did first. And I was able to finish like in less than 8 minutes, something like that, less than 10 minutes, in fact. I was able to finish that. So just have, before you start with your part B and C, you have 45 minutes there. Just have a quick look in less than 1 minute time. What are these about? Part B and part C, A and B. So if you find something is easy, try to finish that one first. The reason I'm saying is sometimes you take more time to finish part B, and when you attempt part A in C part, it will be might be difficult, and in part C, B will be from like questions from the second part will be easy, but by the time your time will be finished and you just write A, B, C or C, D, A, something like that. So there were some assured marks you were supposed to get and you missed it. So this is the technique I was always using. So have a quick glance. മലയാളി ഓഡിയൻസ്, അതായത് നമ്മൾ പാർട്ട് ബി കിട്ടിക്കഴിഞ്ഞ് കഴിയുമ്പോൾ എത്രയും പെട്ടെന്ന് ഇത് നോക്കുക. ആ പാർട്ട് ബി ഒക്കെ ഒന്ന് ആദ്യത്തെ 6 ക്വസ്റ്റ്യൻസ് ഓടിച്ച് നോക്കുക. പാർട്ട് സി എടുത്തിട്ട് അതിനകത്ത് ആദ്യത്തെ 8 എണ്ണത്തിന്റെ ഇതും പിന്നെ ഒരു രണ്ടാമത് അതിനകത്ത് ഒരു പാർട്ട് ബി ഉണ്ടാവുമല്ലോ. അതായത് ഒരു 2 എക്സ്ട്രാക്ട്സ് അല്ലേ ഉള്ളത്. ഒരു എക്സ്ട്രാക്ടിനകത്ത് 8 ക്വസ്റ്റിനും അടുത്ത എക്സ്ട്രാക്ടിനകത്ത് 8 ക്വസ്റ്റിനും. അപ്പൊ അതൊന്ന് പെട്ടെന്ന് ക്വിക്കായിട്ടൊന്ന് നോക്കുക. എന്നിട്ട് അതനുസരിച്ച് ഇപ്പൊ ഒന്ന് അത്യാവശ്യം എളുപ്പമുണ്ട് എന്ന് നോക്കിക്കഴിഞ്ഞാൽ ആൻസർ ചെയ്യുക കേട്ടോ. പിന്നെ വേറെ ചെയ്യേണ്ടത് എന്താന്ന് വെച്ച് കഴിഞ്ഞാല് അപ്പൊ അതനുസരിച്ച് അപ്പൊ ഞാൻ എന്റെ എക്സാമിന് ഈസി ആയിട്ട് എനിക്ക് കംപ്ലീറ്റ് ചെയ്യാൻ പറ്റി. മനസ്സിലായോ? അതായത് ആദ്യത്തെ പാർട്ട് കൺകഷൻ ആയിരുന്നു. രണ്ടാമത്തെ പാർട്ട് വാസ് മോർ അബൌട്ട് ഒരു ഓൾഡ് ഏജ് ഹോമിൽ ഇങ്ങനെ ഒരു ഡെത്തിനെ കുറിച്ചാണ്. സോ അത് ഒത്തിരി ഈസി ആയിട്ട് ഫീൽ ചെയ്തു. സോ അത് എനിക്ക് ആ ഒരു 8 ക്വസ്റ്റ്യൻസ് ഒരു 10 മിനിറ്റിന്റെ അകത്ത് എനിക്ക് പെട്ടെന്ന് ഫിനിഷ് ചെയ്യാൻ പറ്റി. Then I had almost 30 minutes for the remaining 8 plus 6 14 questions. പാർട്ട് ബിയിലെ 6 ക്വസ്റ്റ്യനും പാർട്ട് സിയിലെ 8 ക്വസ്റ്റ്യൻ, ആദ്യത്തെ 8 ക്വസ്റ്റ്യൻസും. അപ്പൊ നമുക്ക് സുഖമായിട്ട് പിന്നെ ഓരോ ക്വസ്റ്റ്യനും 2 മിനിറ്റ് അല്ലെങ്കിൽ 2 മിനിറ്റ് കൂടുതൽ എടുത്ത് നമുക്ക് 2.5 മിനിറ്റ് വീതം എടുത്ത് പ്രാക്ടീസ് ചെയ്യാൻ പറ്റി. പ്രാക്ടീസ് അല്ല, ആൻസർ ചെയ്യാൻ പറ്റി. So I'll repeat again. If you can finish if you find somewhere which is easy for you and if you can finish fast, then you will have more time to finish the remaining 14 or 8 plus 6 questions, 14 questions. So let's look at an example now. Here part B, what I was doing mainly, again I always first read the paragraph before I read the question. Because if you look at the question first, then you will start to look for the answer and you will be getting more and more confused. So I was always reading the paragraph and I write a short note on the side. What is it about? And underline the keywords. Then I will go to the question and I will try to answer. So if this paragraph says the incidence of hospital treated DSH, that is deliberate self-harm, from institutional data was higher in females than males, both in Australia and in New Zealand, and there is some numbers are there. The incidence of hospital treated DSH was highest among those aged 15 to 24 years in both Australia and New Zealand, predominantly due to higher rates in adolescents 15 to 19 years, and however the peak of highest incidence of hospital treated DSH in adolescents and young adults in Australia is less marked when stratified by Aboriginal and Torres Strait Islander status in Australia. Rates of DSH like that, it's so on going and going and going on. So you need to underline the keywords. Now it says, according to this research report, which group of Australian population are most likely to be treated in hospital for deliberate self-harm? So the answers are aged 15 to 19, 15 to 24 and 25 to 49. So if you have a look here, it says the first one says 15 to 19. Where is it mentioning? Here on the middle. However, Australian predominantly due to higher rates in adolescents. 15 to 19. However, the peak of higher sense of hospital. So it says about the adolescence here. That will be like 13 to 18. Now it says women aged 15 to 24. So 15 to 24 comes was highest among those aged in that particular age group in both countries. Now it says women aged 25 to 49. What about they saying? Young adults in Australia less marked when stratified by our stratified islanders in Australia. Rates of DSH among Aboriginal and Torres Strait Islander people aged are higher than for other Australians in the same age group. So it says this is the highest one. So I believe this can be the answer. Women aged, because it says when we compare with everything, other Australians and everything, if for this particular community, this age group 25 to 49 has the highest in males and females, and the question is asking about the females, woman, a group, and I hope everyone know the difference between what is woman and woman. So if it is WOMEN, it means plural, it's a group, and WOMAN, it means a particular person, a particular woman, okay, a particular lady. So I believe this can be. So what I was trying to say that I will always read the paragraph first, mark an idea here, then I'll go to the questions, rather than read the question first and go back to the answer. And when it comes to part C, again, what I was trying to say, part C വരുമ്പോൾ നമുക്ക് എപ്പോഴും അറിയാൻ പറ്റും, it will be always in an order, so it will be easy. So part C, you can start read the question first and look for the answer in para 1. The easy technique you can do is, when it comes to part C, is first put the paragraph numbers for each paragraph, 1 2 3 4 5 6 7 8. How many paragraphs there, write it first, so that it will be easy for you when you look back, because after 3-4 paragraphs it will be saying in fourth paragraph, now you count again 1 2 3. So for it make too easy, you can mark the paragraph first, so that it will be easy for you to come back and have a look, and it will be always in the order. So that's one of the easiest thing. And once you finish with the one question, I can 100% assure you there won't be a question on top of that. Actually, there won't be an answer. So always in a particular order. So that comes a reading part, and I hope reading also, again, it's a little bit difficult and we need to be seriously careful about that, and give your best. That's all I can say at this stage. Now comes our most important part, writing. So like I said, you have 5 minutes of reading time, right? During that 5 minutes time, the criteria I told you guys about, and I hope everyone have this booklet with you, especially the exam batch. Always look at this criteria. ഈ 5 criteria എപ്പോഴും നോക്കണം. Who you writing to, ആർക്കാണ് ലെറ്റർ എഴുതുന്നത്, what is the job role, അവരുടെ ജോലി എന്താണ്, what is your role, who you are you a community nurse, registered nurse, emergency department nurse, or, and what's the purpose and diagnosis or chief complaint, because some letters there won't be a diagnosis, they'll be providing some chief complaints. Like for example, I'm writing regarding Miss X, who has persistent chest pain and sweating, so they'll be providing 1 or 2 or 3 chief complaints, so you need to write as it is. Then again, what type of letter, is it a referral, discharge, urgent, and is it a known or an unknown case? How you will identify? If it says write a letter to Mr. John's physiotherapist, means the physiotherapist already know Mr. John. Write a, if for example, if the letter says write a letter to the local doctor in John's town, it means it's not a known case, it's just a letter to a doctor in that local town of John, where John is living. If it says write a letter to John's GP, that means it's a known case. അതായത് ജോൺസ് physiotherapist എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ അതൊരു നോൺ കേസ് ആണ്. അല്ലാണ്ട് if ഒരു letter write a letter to the local GP in local GP where John is staying അങ്ങനെ എന്തെങ്കിലും തന്നിട്ടുണ്ടെങ്കിൽ അല്ലെങ്കിൽ in John's town എന്നാ തന്നിരിക്കുന്നത് അതൊരു നോൺ കേസ് അല്ല, അതൊരു അൺനോൺ കേസ് ആണ്. കാരണം അത് ജോണിന്റെ ടൗൺ എന്നേ പറഞ്ഞിട്ടുള്ളൂ, ജോണിന്റെ ഡോക്ടർ ആണെന്ന് പറഞ്ഞിട്ടില്ല. സോ അതൊക്കെ ഭയങ്കര കെയർഫുൾ ആയിരിക്കണം. Then this 5 minutes you need to be very careful about these 5 things. If you know these 5 things, you are done with your 20 to 30 or 50%. I'm sure 50%. Either you will completely understand the task. What is it about? For example, if the name is given, for example, it says Mr. Kuchumal Isaac and job title is a community nurse, or and you are a registered nurse, continued care or urgent admission or rehabilitation care. It's a referral letter, so it can be anything. Okay, like we discussed, always mark this 1, 2, 3 over your relevant data. For example, if you take a letter, mark 1 for all the present history. For example, if they say about all these details, like how do we say, the data provided here are all about present history, put 1 here, 1 here, 1 here. Now they provided a past medical history, put 2 here, 2. And if it is a social history, put 3 here. And if it is about discharge advice, put 4 here. So you can put 4 there. And if there is something which you can connect for you, like if the hospitalization says nursing management says here physiotherapy, and in the discharge advice also says continue physiotherapy, then you can write he or she has been initiated on physiotherapy which needs to be continued. Introduction, always make sure that you have 2 sentences, not more than 2 sentences. Those who have a habit of writing more than 2 sentences, they already know, so please be careful. 2 sentences കൂടുതൽ എഴുതുന്നവർക്ക് അവർക്ക് എല്ലാവർക്കും അറിയാം, എല്ലാവരോടും ഞാൻ സംസാരിച്ചിട്ടുണ്ട്. Very careful, and make sure that gender is very important. Mr. Mrs. do not change ആവരുത് എഴുതിക്കൊണ്ടിരിക്കുമ്പോൾ. So that's the reason I always say proofreading. Then when you write a letter to physiotherapist, dietitian or social worker, mention only the things which you are expected her to do in the conclusion paragraph. Remaining other discharge advice, you can make a paragraph just before your concluding paragraph and write it there, if it is a short letter. If no need, then if it is not relevant, do not write it. Okay. And again, if the letter is for physiotherapist, dietitian or social worker, if the medications name are provided, do not write it, which were managed with the regular medication or appropriate medications, and close out. There is no need actually, because they, even if they know about the medication, there is no point actually. They're not going to directly deal with their responsibilities with diet or some social arrangements or with some physiotherapies. Then comes body paragraphs, like we discussed. Always maintain like the order we always say, what admitted with what, assessment details, investigations, management. It can be medical or surgical. So if you mention, if the admitted with a fracture and the patient underwent a surgery, then your diagnosis should be who is recovering or who has been recovering from so and so. And if then during the body paragraph you can write, therefore an X-ray revealed fracture of the pelvis, which confirmed his diagnosis as dash, whatever it may be. And if it is medically managed and there is a lot of data to be written, you can easily write he was managed conservatively so and so, if it is medically managed. If it is small letters, write in detail about what all provided there. What else? Introductions, please have a look whatever I provided to you, like the demo note. Have a look, there are different types, and have a look at the character letters I provided to you, like the one you written, so that you can have a look. You will get an idea how to write introductions quickly. Okay, just before go to the exam center, just have a quick look about all the introduction, different type of introductions. please make sure that you write about, if the letter says a patient is going for 1 month recuperative care, and most of them having a habit of writing for continued care and management, please do not write that. She's being discharged today and 1 month recuperative care is required. That is your purpose. Please write as it is. Okay, for example, the patient is for specialized management. Do not write she requires management from your service. Write specialized management regarding maybe food, like regarding diet, exercise, and smoking. So whatever is provided there, write accordingly. Then conclude as you know, and do not go into the should you recover with further information regarding this elderly woman. Do not write like that. Make sure it's simple. Please contact me if you have queries, because these are also counted in the word counts like we discussed. And you guys are ready, I'm sure that. Let's see how our results will come. അപ്പോൾ മനസ്സിലായെന്ന് വിചാരിക്കുന്നു. റൈറ്റിംഗ് വരുമ്പോൾ വളരെ കെയർഫുൾ ആയിട്ട് പ്ലാൻ ചെയ്ത് കൃത്യമായിട്ട് നോക്കി നോക്കി എല്ലാം എഴുതണം. എക്സാമിന് കയറുന്നതിന് മുൻപ് നമ്മൾ കറക്റ്റഡ് ആയിട്ടുള്ള, ഇപ്പൊ 20 ലെറ്റേഴ്സോളം നമ്മൾ എഴുതിയിട്ടില്ല എല്ലാവരും, 20 അല്ലെങ്കിൽ ക്രാഷ് കോഴ്സിൽ എടുത്ത 10, അതൊക്കെ കൃത്യമായിട്ട് എല്ലാ ലെറ്റേഴ്സും ഒന്ന് നോക്കി കൃത്യമായിട്ട് ഒന്ന് ഇൻട്രൊഡക്ഷൻസ് ഒക്കെ ഒന്ന് വായിച്ച് മനസ്സിലാക്കി വെച്ചിരിക്കുക. പ്രോപ്പർ പ്ലാനിങ് ചെയ്യുക. ഓരോ പാരഗ്രാഫിന് എന്തൊക്കെ എഴുതേണ്ടതെന്ന് കൃത്യമായിട്ട് മനസ്സിലാക്കി വെക്കുക. റെലവെന്റ് അല്ല, ഇപ്പോ ഇഫ് ലെറ്റേഴ്സ് ഈസ് there is no his vital signs were normal, if that sentence is there, do not write that. There is no need, it's not relevant. Or if the patient is admitted with some particular fracture now, and the past history says like 20 years back he had left tibial fracture, do not write. There is no point in writing about that, because it was like 20 years back. If it is a chronic condition, definitely you need to write. Otherwise 20 years back, no need of that history. What else? Concluding, come to the point directly as it is. If it is too many things, like we write, say, it would be greatly appreciated if you could provide Mrs. X with medication compliance, diet, alcohol intake, and whatever. So try to make short, and do not use too many connectives. Do not write sentences with all the connectives. Therefore, please note kindly, make sure that 1 or 2 connectives. Try to use the semicolons in between to, complex sentences like however, semicolon, however. How do you say? He has been initiated on physiotherapy, semicolon, however, comma, he is refusing to walk, or whatever may be the reason. Currently he is making good progress, semicolon, however, comma, he still requires high level of care. So semicolons will be, try to write with semicolons like we discussed before, and you know most of the structures now. And make sure with yours faithfully, yours sincerely, address lines with the dates. If the history is about one same year, do not repeat that year on the body paragraph. If it is about some other years, then you can bring. Otherwise, Mr. X admitted to hospital on April 6, that's good enough. After that, you don't have to put a comma. If you're mentioning about the year only, then you can 06 April, 2017. Otherwise 06 April, no need of comma. Okay, and that's about our connectives again. Therefore, however, owing to, do not write as. Everyone knows, okay, our classes were so nice actually. So as ന്റെ ഉപയോഗം വളരെ ശ്രദ്ധിക്കുക. Do not write as in your introductions or body paragraphs. Try to avoid it. If you want to say like her condition has been stabilized as evidenced by no, take that stabilized, comma, evidenced by, take that. Or you can use since owing to Mr. X is being referred to your facility for rehabilitative care and management owing to her diagnosis of, not as, owing to her diagnosis of dash. Sensitive language, like we discussed before, So careful, write perfectly. Always make sure you do have some time for proofreading. Okay, at least 2 or 3 minutes, because most of the times, even I also made a lot of errors. Like when the letter is about a lady, she after the introduction paragraph and the first paragraph, some places I was writing he was initiated, he did this, he did that. So when I got some proofreading time, I was able to change all that things. So we need to be 100%. Please, 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 please. Even if you couldn't finish the last one or two words, please make sure you did proofreading. Or after finishing each paragraph, make sure that you proofreaded something. Because I know when we discuss every day the letters, most of them are making the mistakes, like Mr. becoming, when we start as Mr. Vaughan, and by the end of the letter, this is Mrs. Vaughan. When we start as she, by the end of the letter, it's a he. So please make sure about all these things. Okay, and lastly we go into our speaking task. Speaking again, start with the, they will introduce themselves, then they will ask your name, then you can introduce. They will ask about the candidate number, so there will be a paper in front of you with your candidate number. And they will be asking about your profession and about the passport or the proof. After that, they will say about, we are moving to the warm-up questions. Warm-up questions, I'm sure everyone is ready, right? We practiced every day. So from day one, we all are practicing with the warm-ups. So I'm sure you will nail it, rock it with the warm-ups. And then comes the speaking topics. We have 2 role plays, 3 minutes preparation time. During the preparation time, if you have any doubts or any pronunciation problems, please ask them and write it down. If you did not understand that pronunciation, write it down in Malayalam. If it says persuade, persuading, but some says persuade or persuading, so you need to write it down in the Malayalam exactly, so that it will be easy for you in your own language. If you cannot pronounce, for example, we all say pizza, pizza, but in fact the pronunciation is pizza, pizza. So we need to know the pronunciations. So you can ask them, they will help you. I'm sure they will help you. And like we discussed, if the hospital task, make sure that you ask the name in front, or if it is a non-case letter, non-case speaking task. Like if the patient is admitted, for example, there is a task for anorexia nervosa where the patient is already there in the trauma and he's getting a drip. That means you already know the name. Remember that module we practiced yesterday. It says the patient has, you just completed the examination and you're going to do the assessment or collect history. That means you already know the patient. So one thing you can do, you can ask the name in front, or you can ask reconfirmation. Could you please tell me your name for my confirmation? So these days the task we are getting is like big long task. So if you waste that time for 20-30 seconds for the name and everything, it will be another burden. And like we discussed, if there is anxiousness, concerned, worried, then you can definitely start, how do we say, you look a bit anxious, could you please tell me what's bothering you? So if you have a look at this particular task, let's have a quick look. Okay, for example, I'm going to answer this, how you going to do. So how do we start? Good morning, my name is Rinku Johnny, one of the registered nurses working in this community health center. Or you can say good morning, I'm the staff nurse on duty today in this community health center, you can call me Rinku. Please be seated, because always make sure, if it is not a hospital task, if the patient is not admitted, then make sure you can say please be seated. Then thank you. How can I address you? Do not ask your good name or something. How can I address you? After that, how can I help you? How can I help you, Mr. Joseph or Mr. Sam? Then he will say his problem. After hearing the problem, here the task is to find out the reason for visit. So you can ask in a way, yeah, Mr. Joseph, you look a bit anxious. Could you please tell me what's bothering you? So he will say his problem. Then you can say, you can reassure him. I completely understand your concern. But no worry, we are here to help you. But in order to get a better understanding, I would like to ask you some questions regarding your mother's health status. Remember again, this is the bystander is here, and we are discussing about the mother. So do not say, I would like to ask you regarding. I would like to get a better idea regarding your condition, not your condition, your mother's condition. or your mother's health status. So tell me about her medical history. Does she having any problem like that? Any with any medications? Is she taking any medications? Is she allergic to something? After, you can say, thank you for providing me the information. We do appreciate that, and they are very valuable for our records. And maybe you can say, based on the information you provided, I can say that your mother's blood investigations are just for routine purpose, considering her age as she is 80, and they are for cholesterol, electrolytes, and kidney function. So there is nothing to be worried about, Mr. Joseph. It's just a normal investigation. And then the patient will say, but nurse, I heard that there will be some pain, or there will be some complications regarding blood sampling as she going for the first time. So you can say like, no worries, Mr. Joseph. You can Like you said, you can expect some minimal pain during the procedure, and there will be some side effects, like possible side effects like bruising, hematoma, or swelling, considering her age, as considering age. But immediately after the procedure, we will be providing a small pressure dressing for her to prevent all these side effects. Is that clear to you? That's perfectly clear for me, nurse. But nurse, my mother looks always a bit anxious, worried, or something. Is there something we can do for that? Mr. Joseph, what I would like to recommend you is that please provide support for your mother, especially during the health checkups or hospital visit, since she is to avoid loneliness, and I believe you will be able to do that. Being said that, do you have any concerns? No, nurse. Thank you for listening me, and I wish your mother a healthy future ahead, because she's 80. She doesn't have any problems. You can say, I wish your mother a healthy future ahead, and you need to improvise. How you improvise? Right away, I'm going to do the blood sampling for your mother, and you may wait here. Once I'm finished, I'll come back and update you. Meanwhile, if you have any queries, or if you want to know anything, please, what do you say? Not ring the bell. Actually, this is not a hospital task. So please contact directly, or you can come and ask, or something like that. Okay. So make sure that you perform, and I know all are ready.